Hello and welcome to the Nurse Station. I am Ray Mobley and today we are going to talk about safety checks. And let me be very clear. Yes, this is more geared towards the student about to go into clinical and this is your first time and you really just want your standard, this is how I keep somebody safe. However, this should be ingrained into us as healthcare providers. Everything we should do should be centered around safety. So if you can just get into the habit, I've done this so many times, I innately do it as I walk into the room, and I just encourage you to have your method that you verify your patient's safety. Your facility or whatever organization you work for will have policies around this. But this is what I tell my students, and this is how I prepare them for clinicals, like of what to think about both prior to going into the room and when you're in the room. So let's start with the big four prior to going in the room, okay? We are in a digital age. We rely so much on the EMR, right? The electronic medical record. And sometimes, depending on where you're doing clinical, there's a computer in every patient room. Well, that's not true for every setting. So I always tell my students, for instance, sometimes they start in a skilled nursing facility and the patients could live there. That's their home. They might not have a DNR, a do not resuscitate armband. They need to know their code status. So if they walk in the room and the patient's unresponsive, they need to know how to respond. I think sometimes we rely so heavily on armbands or the chart right in front of us. That's not true for every setting. So I always want you to kind of have this ingrained before going into the room for each of your patients. What is their code status? Are they a full code? Are they a do not resuscitate? What is their diet? Their activity status and allergies. And to go a little further, diet, right? If they are NPO and they ask you for a drink and you don't know their NPO, you could give it to them. Also, y'all, my students, when y'all answer call bells, which you should, right? We're a guest. We want to put our first foot forward. We want people to see us. So if we want to work on that unit one day, we have an opening, we have an opportunity. So do your best, perform your best. And of course, number one, keep patients safe. But if you're answering call lights because your patient care, your patients are situated, you need to think about these things before doing it. What if you go in a room and they need to get up to the toilet and you don't know their activity status? Verify that before helping them. Again, diet. What if a patient that's not yours asks for Diet Coke in their NPO for a procedure? These things should be ingrained into us for the patients we care for and also if we're going to go assist in another room, okay? Now, allergies. I don't want you to just know your patient's allergies. I want you to verify them. In your EMR, in your chart, it could say no known allergies. I need you to ask them before medication administration. You'd be surprised what is not listed that should be. So I want you to kind of always know these standard things about your patient before even going into the room, okay? Also, if you're helping in another room, really consider you need to know these things before doing certain things. You can't mobilize somebody if you don't know their activity status. You can't give them food if you don't know their diet. So these are just good things to understand in general for all patients. Now, upon going into a room, this is kind of what I think for safety. And I want to encourage y'all, my brand new nurses especially, you do not know everything. I don't know everything. Nobody knows everything. When you sign up to be a nurse, you have also signed up for lifelong learning, continuous professional growth and development, because we will never know everything. But that will come. You will feel confident in your job role with time that you deserve to learn. But we do need to keep patients basically safe. That is what is asked of you. So this is what I think of for basic safety. And I'm doing it very broad in general because caring for a NICU, a patient in the NICU versus a patient in critical care, adult critical care, it's different. You'll have to add things to your safety checklist and things like this. But overall, in general, regardless if I'm in a clinical with my students in a rehab to an inpatient setting, these things I'm aware of and they're being done. So this is what I use. This is what I encourage my students to know. And I'm going to walk you through it. So upon entering the room, knock, 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 perform hand hygiene and don appropriate PPE is step one. I'm going to tell you, if I was your clinical instructor, my students can attest. If there is a isolation precaution sign on the door or however your hospital does it, and they even drop off a food tray, they need to be an appropriate PPE. I'm sorry, there's no shortcuts. when we take shortcuts, we are not keeping people safe. So if, for instance, they're on contact precautions, you should have a gown and glove on prior to entering a room, even if it's just a drop off a food tray, okay? So make sure this is step one, okay? Step two, I'm kind of doing how I walk into the room. Please introduce yourself. I'm gonna let y'all know, like, my students that only know a patient by their diagnosis, that is a human being. That is somebody's loved one. We need to make sure they know who we are, and we need to tell them what they're doing, even if they can't speak back, even if they're in a comatose state. You should constantly be speaking to your patients, okay? So make sure to introduce yourself, make sure you have the right patient, right? We have many ways we can verify that. Our ID band is the most common, but again, some settings, like nursing homes, they might not have that. So you have to verify you have the right patient, right? We have pictures in the charts. We have ways we verify our patients. And as we're doing that, think about inspection. You're walking into the room, you're off gate seeing their chest rise and fall. How are they breathing? Is it labored? Is it a normal rate, right? You should be inspecting those things. You should always note if they are on an oxygen source. So is it room air, or do they have a nasal cannula, a simple face mask? Always note that upon inspection as you're walking towards your patient. And when you introduce yourself and they speak back, you get a lot of information. Their level of consciousness, their orientation, their speech. Why this is so important, the moment any of this changes, you should know to do something about it. For instance, your patient is speaking clearly. After lunch, all of a sudden they have slurred speech. That's not okay. Those small changes, and that's not a small change, but we should be catching small changes, right? That's showing us a potential problem. So you're looking at these upon inspection. You're assessing their level of consciousness, orientation, and speech when they speak back to you. Position and need for toileting and pain medicine. I can't tell you how many times I've walked in the room and my patient has slid all the way down in the bed. We need to make sure they're in an appropriate, comfortable position. And a lot of times when we walk into a room, yes, this is all considering safety. We're walking in there for a purpose, right? Bedside shift report. We have meds to give, whatever it might be. Please don't try to do your nursing task without ensuring that their pain is controlled and they don't need a toilet. For instance, if I have to do a full admission, my patient's going to be sitting there for a while, I need to make sure these things are controlled. So seek if they need to use the bathroom. Ensure that their pain is controlled and medicate appropriately. Now, check equipment. We have a habit, and it is not a safe habit in healthcare, to silence alarms. Alarms are going off for a reason. So if something is alarming, you need to check it. You need to check all equipment in that room. The oxygen, the IV pumps, the SCDs, right? The compression devices that help prevent venostasis, that are constantly pumping up to make sure that we're trying to prevent blood clots. All those things should be checked. Any equipment in that room, especially if it's alarming, okay? Pay attention and fix the problem. Now, access devices. You should always take a peek at your access device when you're performing your safety checks and upon just any time you enter your patient's room. So your facility or wherever you're doing clinical, they're gonna have their practice of safety checks, right? For instance, my facility does hourly rounding. The nurses round on this hour and our assistive personnel, so for instance, our nurse aides are rounding on the other hour. So there is a process in place, and you should always be thinking about these things. But when you're looking at your access devices, for instance, peripheral IVs, PICC lines, central lines, you need to assess the site. You need to make sure the dressing's clean, dry, and intact, and you also need to trace your medication lines. If a med is being infused into a port, for instance, you need to follow that pathway and ensure that the correct medication is going into the right place, okay? Now, tubes and drains free of occlusion, any tube or drain. Foley catheters, JP drains, NG tubes, chest tubes. All drains should be looked at and ensure that, number one, they're intact and that they are free of occlusion and they are draining effectively. So our Foley catheter bag should never be above the bladder, right? They should be positioned below the bladder on an appropriate site, never like a side rail, so that urine can drain by gravity. So check all tubes and drains that they're free of occlusion. Fall precautions. I'm gonna say I've been a clinical instructor for over a decade now. This is something I constantly have to educate my students about. And I always tell my students, you don't know what you don't know, right? I'm here to help you. That's my job, is to facilitate your success as a teacher. But I can't tell you Even, I mean, we talk about all these things. How many times, for instance, I've seen students get patients up or almost get them up because I've stopped them without any footwear on. I mean, bare feet. That's not okay. All patients need to be mobilized or ambulated or toileted if they have to get up and move around in non-skid footwear, whether that's appropriate shoes or they have the socks with the grippies, right? All wheels should be locked when we're caring for a patient. Bed wheels, chair wheels, whatever the wheels might be. Our beds should be in low position. They should have appropriate bed alarms and chair alarms if indicated. We need to keep them safe. And another big part of this fall precautions is, how do they mobilize? If they're 2+ assists getting up, you don't touch them by yourself. If they need a lift, use a lift. We have to mobilize and transfer patients safely. So make sure you understand their fall precautions. Don't get a patient up if you don't know how to get them up. Always make sure when you do, they have non-skid footwear on, and all the other things that we've talked about. Incisions, wounds, and bony prominences. This is kind of just whatever they're there for, right? If they're post-op, check their incision, right? Make sure that it's clean, dry, and intact. Make sure that they don't have any abnormal drainage. Any wounds that they are there for that you already know about, make sure that you're monitoring routinely. And then, of course, bony prominences. Upon admission, you have to look at every single pressure point on that body. We need to make sure they don't have any wounds coming into our facilities, okay? And then routinely after that, if they're completely immobile, you need to turn them Q2. You need to elevate their heels if needed. Like, we need to make sure that we're monitoring these things for safety. Possessions. So you want patients' possessions, and more so than I've ever seen before, cell phones, right? Close to them. We don't want their purses, their cell phones, anything they need and use routinely far away, because then they're getting up. Not saying that they can't get up without assistance, that's dependent on their activity, but they are higher risk of falling in healthcare. So we want their possessions close to them, and then always ensure that your environment is clear of clutter. Nothing should be on the floor. There should be no trip hazards. If you have anything dangling from the bed, for instance, restraints can be super long, right? We need to be tucking the excess under the mattress. We need to make sure that there's no trip hazards in our patients' ways. So this is, again, ingrained into my students. They know these things should be identified before even walking in the room. And as they walk in the room, they're assessing all these things. And again, you will develop your way, okay? Just like I developed mine. I just encourage you when it comes to safety checks to have a way. Your facility will tell you what has to be done as a starting point, but this is something that should be innate and ingrained in us every time we walk into a patient's room. So if you haven't gotten into clinical yet, I encourage you. You can do this. All you got to do is make sure to keep patients safe, right? That basic safety is what is asked of you, and then the rest you will learn along the way. So as always, if this helped you, help someone else, and then modify this list based upon the patients you're caring for or the unit or facility your clinicals are at or that you currently work at. So take care.